Hi everyone, my name is Joseph Baraza and welcome to my presentation of the United States Medicare Insurance Health Coverage Program. So the scenario that the presentation is based upon is that your mother has just turned 65 and she is now eligible for Medicare. What a blessing. Up to this point, she has been covered under your father's independent insurance plan, and they have been spending a fortune on her asthma medications and injections for her allergies. She has also had breast cancer 15 years ago. Determine who you contact and where you go to apply for Medicare, secure and complete any application for coverage. First, we need to understand the meaning of Medicare. Medicare is a federal government insurance program and is administered by the Centers for Medicare and Medicaid Services, also known as CMS. The program was founded on the 30th of July 1965 in Independence, Missouri. Its main office is based in Baltimore, Maryland. Medicare provides health insurance coverage for individuals aged 65 or older, and to be eligible, you must be a U.S. citizen or a permanent legal resident who has lived in the United States for at least 5 years. You should be receiving Social Security or Railroad retirement benefits, or have worked long enough to be eligible for those benefits but are not yet collecting them. Or either you should, or your spouse is a government employee or retiree who has not paid into Social Security but has paid Medicare payroll taxes while working. Now, individuals below the age of 65 may also qualify for Medicare coverage if you have been entitled to Social Security disability benefits for at least 24 months, and these ones, they don't need to be consecutive. If you also receive a disability pension from the Railroad Retirement Board and meet certain conditions, or if you have Lou Gehrig's disease, also known as amyotrophic lateral sclerosis or ALS, which qualifies you immediately. Or if you are diagnosed with end-stage renal disease or ESRD, which is a permanent kidney failure requiring regular dialysis or kidney transplant. Or if you or your spouse has paid Social Security taxes for a specific period or for a specified period depending on your age. Now let us look at different parts of Medicare. Medicare has 4 parts. There's Part A, Part B, Part C, and Part D, which we are going to look at them separately. To begin, Part A is also called hospital insurance. It covers inpatient hospital stays where the beneficiary has been formally admitted to the hospital. It also covers skilled nursing and hospice services, including semi-private room, food, and tests. Now, Medicare Part A covers inpatient hospital stays so long as certain conditions are met. The first one is in order for your hospital stay to be covered by Part A, you must be admitted to the hospital under a doctor's order. This is when a doctor formally recommends you to stay in a hospital to receive treatment or care. Your hospital must accept Medicare in order for your stay to be covered. In some cases, a hospital board must also approve your stay. Your doctor must order home health services for them to be covered by Medicare Part A. Your doctor must also certify that you are homebound, which means both that you cannot easily leave your home and that it's medically dangerous for you to do so. Part A also covers nursing home coverage treatment, and nursing home coverage treatment must meet some requirements in order to be covered. Nursing home coverage typically requires a qualifying hospital to a hospital stay related to your need for skilled nursing. Your nursing home must also accept Medicare Part A. Part A premiums include an inpatient hospital deductible of $1,408, coinsurance per day as a $352 after 61 days confinement within one spell of illness. Coinsurance for lifetime reserves, essentially 91 to 150 of one or more stay of more than 60 days. And this one you pay $704 per day. The maximum length of stay that Medicare Part A covers in a hospital admitted inpatient stay or a series of stays is typically 90 days. The first 60 days will be paid by Medicare in full, except one copay, also and more commonly referred to as deductible, at the beginning of 60 days of $1,340. So days 61 to 90 require a co-payment of $335 per day. And Part A fully covers brief stays for rehabilitation or convalescence in a skilled nursing facility, and up to 100 days per medical necessity with a copay if certain criteria are met. The first 20 days will be paid full by Medicare, with the remaining 80 days requiring a co-payment of $167.50 per day. Now let us look at Part B of Medicare. Part B is also called Medical Services Insurance. It covers outpatient services, including some providers' services while inpatient at the hospital. It also covers outpatient hospital charges and most provider office visits, and also covers most professionally administered prescription drugs. Part B coverage also includes outpatient physician services, visiting nurse, X-ray, laboratory and diagnostic tests, influenza and pneumonia vaccinations, blood transfusions, renal dialysis, outpatient hospital procedures, limited ambulance transportation, immunosuppressive drugs for organ transplant recipients, chemotherapy, hormonal treatments such as Lapron. It also covers other outpatient medical treatments administered in a doctor's office. And this one also includes chiropractic care. So one thing to note is that medication administration is covered under Part B, is optional. Everyone who is eligible for free Medicare Part A is eligible for Part B. And Part B coverage begins once a patient meets his or her deductible of $183. Part B coverage covers 100% for preventative services such as yearly mammogram screenings, osteoporosis screening, and many other preventative screenings. Now let us look at Part C. Part C is also known as Managed Care or Medicare Advantage plans. Part C covers prescription drugs which are self-administered. Part C is a type of Medicare health plan offered by a private company that contracts with Medicare. Medicare Advantage plans provide all Part A and Part B benefits. Medicare Advantage plans include healthcare maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, and Medicare medical savings plans. Let us look at Part D of Medicare. Part D is a prescription drug insurance coverage Medicare Part D is a prescription drug insurance for seniors. This program is an add-on to traditional Medicare and offers drug coverage for most people over the age of 65. While Part A and Part B are offered by the federal government, Medicare Part D's coverage is provided by private insurance companies. You'll need to purchase a Part D coverage from a private insurance company for your medications to be covered. If you choose traditional Medicare, where you enroll in Part A and Part B through the government, you can purchase Part D coverage as a standalone policy from a private company. You can also add Part D to a Medicare supplement plan, also known as Medi-Gap, or you can select a Medicare Advantage plan that includes prescription coverage. Medicare Part D is also optional coverage, but you also pay less if you enroll as soon as you're eligible. So seniors who wait to sign up may face late enrollment costs. Let us look at some of the terms in Part D. So these are the terms and conditions. Anyone with Part A or Part B is eligible for Part D, which covers mostly self-administered drugs. So to get Medicare drug coverage, an individual must join a Medicare approved plan that offers drug coverage. Each plan can vary in cost and specific drugs covered. Call your Medicare drug plan to find out the specific drug coverage rules that apply for you. Some drug plan coverage rules include medication safety checks. So this is the dosage or interactions with other drugs. Another rule is prior authorization. Prior authorization are plans which may also use authorization when they cover a drug for only certain medical conditions that are approved for. Quantity limits. These are limits for safety and cost reasons. So plans may limit the amount of prescription drugs they cover over a certain period of time. Now let us look at Medi-Gap. What is Medi-Gap and how does it work? Medi-Gap is a supplement insurance policy sold by private companies that can be used along with Medicare Part A and Part B to fill the gaps in their coverage. It can help you cover costs related to deductibles, copayments, coinsurance, and more. Some Medi-Gap policies provide coverage for medical services that don't fall under original Medicare. One example is a doctor or a hospital visits that take place when you are traveling in another country. A Medi-Gap policy will typically pay the difference between the total healthcare cost and the Medicare approved amount. You must have Medicare Part A and Part B in order to obtain a Medi-Gap policy. A Medi-Gap policy can be purchased from any insurance carrier that is licensed in your state to sell one. For the most part, Medicare plans are designed to cover out-of-pocket costs for services that are covered by Medicare, as opposed to that Medicare doesn't cover and the enrollee has to pay entirely out of pocket. And for example, Medi-Gap plans do not cover dental and vision charges, as original Medicare Parts A and B do not provide routine dental and vision coverage. Now let us look at some of examples of coverage benefits offered by Medi-Gap. There is foreign exchange, and it covers up to a limit. It also covers out-of-pocket limit, Part A hospice care coinsurance or co-payment. It also covers Part A deductible, Part B excess charges. It also covers Part B coinsurance co-payment, blood for the first 3 pints, Part A coinsurance and hospital cost up to 365 days after Medicare benefits are used up. It also covers Part B deductible and skilled nursing facility coinsurance. Now, how do you apply for Medicare? The first step is you need to learn about Medicare basics. You need to learn about the parts of Medicare, learn about the general costs for your plan, and you also need to learn how Medicare works, and that is if you're working past the age of 65. Step 2, you can go to the website for medicare.gov and you can sign up, and first you'll sign up for parts A and B, and then when you're done, your coverage, you need to find out when your coverage starts after signing up. And step 3, you can get more coverage once your coverage starts, and this you need to review your options for more coverage and how to get it, and you can browse those plans on the website. And on top of that, you can buy a Medi-Gap policy that I have just mentioned. And step 4, you will start using your coverage, whether it's parts A or B, and you need to find out how to get services, be from your local healthcare organization or a hospital, and you'll be given a Medicare card which will state which parts of Medicare that you're covered with. So what coverage did I choose for the scenario that we are given? So since the mother just turned 65 years old, she's now eligible to sign up for both Part A, that is hospital insurance, Part B, medical insurance, and Part D, prescription drugs. Part A, hospital insurance, will cover her inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Part B, medical insurance, will cover specific doctor visits, services, outpatient care, medical supplies for her asthma and injections for her allergies, and preventative services for her breast cancer that she was diagnosed with 15 years ago. Part D, prescription drug plans. This insurance coverage will cover her prescription drugs for her asthma and injections for her allergies. So some of the successes of Medicare is that Medicare provides access to has provided access to healthcare for more than 50 million Americans, and also Medicare has covered hundreds of millions of people since its inception in 1965. Third, Medicare has shielded countless millions of people from financial debt due to the high cost of medical expenses, and this protection that many people outside Medicare still lack, and that is around 35 million Americans. Medicare also has sparked spectacular growth in hospitals, in medical practices, pharmaceutical companies, and medical device manufacturers. The other success is that Medicare is efficient. It operates with an overhead of 2% compared to 20% in private health insurance. And lastly is that incidentally, Medicare ended segregation in over 1,000 hospitals in the south of the United States, since its substantial benefits were withheld from institutions that maintained separate wards based on race. Some of the difficulties in Medicare is that Medicare has become more intertwined with private health insurance industry, making healthcare overall much more complicated and expensive for its beneficiaries. Medicare has also failed to address adequately the cost of medical care. And lastly is Medicare benefits are too thin in many instances. People over 65 spend an average of 20% of their income on healthcare expenses. So what advice would I give to someone else going through the process of applying for Medicare, either Part A, B, C, or D? The first thing is you need to do your research online and in person. That means that you have to check all the relevant information before you apply. Verify the type of medical services your plan covers, including prescription drugs and self-administered drugs. Then you need to verify your health provider. You need to verify with your health care provider which parts of Medicare they accept, and this is because some healthcare organizations do only accept certain parts of Medicare. Others will accept Part A and B, and others will accept Part D or C or Medi-Gap. The next thing is you need to calculate and verify how much premiums you'll be required to pay per month, including deductibles, co-payments, and co-insurance. And one of the most important thing is that you need to enroll as soon as you are eligible for Medicare. Seniors who wait to sign up may face late enrollment costs. Now let us look at some relevant health insurance terms and concepts. One of them is ALS. This is amyotrophic lateral sclerosis or Lou Gehrig's disease. The other word is claim. A claim is a request for payment that you submit to Medicare or other healthcare insurance when you get items and services that you're covered. Co-insurance, an amount you may be required to pay as your share of the cost for services after you pay any deductibles. And co-insurance is usually a percentage. Maybe an example is 20%. The other term is co-payment, an amount you may be required to pay as your share of cost for medical services or supply, like a doctor's visit or hospital outpatient visit or a prescription drug. And the co-payment is usually a set amount rather than a percentage. For example, you may pay $10 or $20 for a doctor's visit or prescription drug. Coverage determination and Part D. So this is in Part D. This is the first decision made by your Medicare drug program and not a pharmacy about your drug benefits, including whether a particular drug is covered, whether you have met all the requirements for getting a requested drug, or how much you're required to pay for a drug, whether to make an exception to a plan rule when you request it. The other relevant term is deductible. Deductible is the amount you must pay for healthcare or prescriptions before original Medicare. Your Medicare Advantage plan, your Medicare drug plan, or your other insurance begins to pay. Formulary. Formulary is a list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits. Formulary is also called a drug list. Out-of-pocket costs. Out-of-pocket costs is health or prescription drug costs that you must pay on your own because they aren't covered by Medicare or other insurance. Penalty is an amount added to your monthly premium for Part B or Medicare drug plan Part D if you don't join when you are first eligible. You pay these higher amounts as long as you have Medicare, and there are some exceptions. Premium. Premium is the periodic payment to Medicare, an insurance company, or a healthcare plan for health or prescription drug coverage. And last is prior authorization. Prior authorization is an approval that you must get from a drug plan before you fill your prescription in order for the prescription to be covered by your plan. Your Medicare drug plan may require prior authorization for certain drugs. How will the knowledge of Medicare apply to my career as a healthcare executive? So personally learning about Medicare Part A, B, C, and D, including Medi-Gap, has equipped me with the knowledge that will enable me as a healthcare administrator advise and assist people who are eligible to apply for such plans. And the experience I've gained so far has provided me with an added advantage to know and determine how best I can serve those I am responsible for, including my family and myself. In summary, Medicare is an insurance program that can help cover expensive medical expenses, including drug prescriptions for the elderly and those with disabilities. Thank you very much for watching this presentation, and if you have any questions, please don't hesitate to ask, as well as any comments or any relevant information that I may have left out.